14th patient came in approximately 45 minutes later, that number had ballooned to about 50 or 60 care providers. They've gone through extensive training to be prepared for those injuries, and we're very thankful that they were there and they're prepared to help take care of the patients that we received.
Doctor, did all the patients come via ambulance, or were there any who came via private vehicle or walked in?
All of the patients were brought in either by ambulance or by first responders.
Doctor, I know hospitals train all the time for mass casualty events. How did that training prepare you, and did it match the reality?
Again, I think our team did an amazing job. They provided a high level of expertise. We're very thankful that they were able to get as many patients into our trauma bays and into our operating rooms as we were able to. They train regularly, and again, I think it showed.
Who coordinated whether a patient went to you, went to St. Mary's, or ended up, as I think at least one did, get transferred to Portland?
As I mentioned, and as you can tell by the time frame, that situation unfolded very, very quickly. So I would suggest that they came to us based on the experience of the ambulance drivers and the proximity to our facility.
You weren't doing the triage role yourself, for example?
We received the patients as they came to us.
What was the number of people on duty at the hospital last night? How did that correspond to normal staffing levels?
We had our normal staffing available last night, and as I mentioned when I referenced the ballooning, we had approximately 100 team members who were off duty come into the hospital to help ensure that we were able to care for not only the patients that we received from these horrible scene, but also take care of the patients that we had there.
From a law enforcement perspective, we're seeing sheriff's deputies and police officers from other jurisdictions come here to help out. Is it similar when it comes to healthcare? Are you seeing doctors and nurses from other towns and areas come and lend a hand? And if so, is that something that is helpful and that you'd like to see happen?
Certainly in the short term, there is an outpouring of assistance that's being offered, and you don't know what resources you need or don't need, so it is helpful. We were able to organize those resources and use them effectively. As an example, we had ambulance services from other counties coming on site. At one point, we had approximately 10 ambulance crews standing by outside of our trauma center to ensure that if we had patients who needed to be transferred, they could be transferred. We received nurses and physicians from some of our area hospitals. We had helicopter support, not only from our own Life Flight of Maine, but also from Boston Med Flight and from Dartmouth. So the long answer to that, or the short answer is yes.
Dr., what about the lockdown? Obviously, there was a large police presence outside of the hospital this morning. How long do you anticipate that to be in effect, and why exactly do you need armed personnel outside of the hospital at this time?
So we're taking the lead from law enforcement, and they're the ones who are telling us what we need to do and how we need to do it. As long as the city is in, what's the term that they use? Shelter in place. As long as we're in a shelter in place, then we will continue to remain in our current status.
This kind of event happens a lot in America. A lot of hospitals like yours have to deal with situations like this. Do you have a professional opinion about the fact that this is part of what the American medical community regularly has to respond to?
It's a good question. I don't know that I have a professional opinion about having to respond to this. I would just say that it's a tragedy, and I think we should do our best to respect the families, those people who have been impacted, the caregivers. I'll just add one thing, just talking about that. We do have an incredible amount of support for people who are going through a difficult time right now, mental health issues, any kind of stress or anxiety from not only the events that have happened, but having to witness some of it. And so we're continuing to provide those resources, and much to the question asked earlier about other areas and other neighboring towns or communities, we've received a lot of support from neighboring towns, communities, and agencies from around the state in order to offer support not only to the patients and families that we have, but also to our team members.
Last question.
Is there a call to action at all for blood drive? I know people want to know if they can help out.
For right now, we and I believe the other trauma centers in the state are very adequately supplied with blood and other supplies. I think the one thing that I would ask for people who are at home right now is if you're in an area where you're being asked to shelter in place, please do so and stay safe.
Can we go back to one point from earlier? Can you, the amount of time that elapsed from when you first got notified, the first patient arrived, till the last one, and obviously some admitted, some not.
Sure. Yeah, that time frame was approximately 45 minutes, and we received 14 patients, critically ill patients at that time, over 45 minutes. So that happened very quickly, and our teams responded exceptionally well.
Thank you all. We'll keep you posted. State Police will have information